Dr. John Shumko is Medical Director of Sports Injury and Assessment at the Matthew J. Morahan III Health Assessment Center for Athletes at RWJBarnabas Health. Good to see you, John.
You too, Steve. Thank you.
It is challenging to protect young athletes, particularly when it comes to concussions, is it not?
Oh, yes, it is. Very much so.
And right now there is an effort afoot on the governmental side, particularly in the state legislature, right?
Correct.
What is it? Describe it.
Well, there's two. There's one that's been out there, a mandate and law for return to play. And any athlete that's suspected of concussion is removed from play and further assessed, goes through a process to make sure that that concussion recovers properly, and any return to play, they do it safely. The second one is return to learn, which actually takes place before an athlete will return to full play activities. The return to learn is important because we have to remember that a concussion is a pathophysiological condition. There's nothing structural that we can see. The chemical changes that occur in a concussion cause cognitive deficits. It's more of a functional than a structural type of problem. So in doing so, there are functional deficits, cognition, difficulty concentrating, sensitivity to light, noise, headaches. So that will interfere with the athlete's participation in school. So it's important to consider that too, and to return him not only to play, but return him to learning in the school with accommodations and restrictions so that he is able to return safely and participate in school and not drop back and lose time.
Is there anyone that should be against this, Doctor?
No, I think it's crazy anybody's against this. This is all put out there to help these athletes that sustain a concussion return safely to learning and to their playing activity.
Doctor, you and I, Dr. Shumko and I have had a lot of offline conversations about this as well. We have young children who are into athletics. We've talked about our kids. I know that you take care of all kinds of young people with sports injuries. Explain the Morahan operation up at RWJBarnabas Health and why it's so important for young athletes.
Well, you know, when we look at schools, schools kind of have followed these mandates, but they're at a minimal type of response that's possible for them to do. You know, the education of the parents, the athletic trainers get, education and get yearly training. That's important. They are to identify the concussions and remove that athlete from play. At the Matthew J. Morahan Center, we go further. We're do the maximum what can be done. For example,
you're ahead of me.
An athlete comes in, whether they had a suspected concussion, they go to the emergency room, the athletic trainer may send them, the emergency room sends them after seeing them, or the pediatrician may send them over to the center. At that point, they're assessed. What I mean by that is there's no one test that can really detect a concussion. No MRI, no scans, no blood work as of yet that can do that. Again, because it's not structural. It's a chemical, physiological imbalance in the brain. So it needs a recovery period. The center will apply certain tests. These are cognitive tests, balance testing, number sequencing, cognitive computer testing, as well as vestibular or visual type of testing.
Can you see it right away, Doctor? I mean, could you see the effects of a concussion right away?
You can. They could be immediate or they can occur minutes or even hours later. And usually, it doesn't have to include a loss of consciousness, but this
does not.
No, it doesn't.
Someone says, well, the kid didn't go out.
No, and that's fine, but they could be confused. They could have a headache. They could be sensitive to light. They could have a little bit of drowsiness or not feeling right. Not feeling right, not being able to get back and know exactly what's going on. There could be some retrograde or anterior grade amnesia involved with this.
It doesn't have to interrupting, John. Kid comes back too quickly from a concussion, what could it mean?
Very dangerous. I mean, if they come back too soon, in these young kids, it's a developing brain. Up to the age of 23, we have a developing brain, which means they're at higher risk for a second impact syndrome. What that is, it doesn't have to be a very serious head injury or hit to the head if they're first concussion. If they're still symptomatic and go back too soon, a light hit, a much lesser hit to the head, can result in a devastating type of condition known as second impact. What happens then is there's an increased volume, blood volume, into the brain. And what happens is the brain will herniate. and the brainstem herniates, and this can occur in death in a matter of minutes. So it's very important to identify the concussion, treat it appropriately, give it the time that's necessary so those kind of things don't happen. Even though it's rare, it can happen.
Are we doing enough to protect kids? Is football worse than soccer or hockey or whatever? Is it worse, or
Well,
head injuries a potential problem in all sports?
When we look at football, it's probably more than soccer that we see concussions. When we look at girls, it's probably soccer. That's probably the most.
Because of the headers?
Right.
Okay.
And the way, you going forward ball, looking down at the ball, colliding, that happens. In boys, it's not the number one. The number one that's listed that we read a lot is wrestling.
Is wrestling?
Wrestling.
Because
of, impact into the ground, the contusion, the way the body is moved. You got to remember that you don't have to get hit in the head with a concussion.
Translate.
What happens is the skull, which is created to protect the brain. So the brain is kind of a jello-y type of, to say the best, a jello-y type of structure. And it's encased in a bony structure, the skull, which is there to protect it. But when a body gets hit, and that could be a very forceful hit to the face, the upper body, or they go down and they hit, it's almost like a whiplash, the brain gets jolted inside that case and bounces off the skull, and it's concussed. So at that point, the chemical imbalance, that physiological change occurs, and the changes in function that are a consequence of that, that's what we see. So you don't have to get hit in the head necessarily.
A few seconds left. Advice to parents right now who want to protect their kids.
You want to protect your kids, listen to what's out there. Get educated. Go ahead and call the Moran Center. There are screenings that are available that we do periodically. We really offer these to parents. They could go ahead and they could get their children assessed. Listen to what's out there. Listen to your kid. You know your kid probably the best. Look and watch what they're doing after a game. Hopefully, and it seems that the athletic trainers and the coaches are getting better educated at this. I think that we're identifying and we're more aware of concussions. That's how come the incidence and rates are going up, because we are more knowledgeable of this and we're identifying. And I think it's important not to take that risk. If there's any suspect of a concussion, get that child out and get them further assessed.
Dr. John Shumko at the Morahan Center at RWJ Barnabas Health, thank you.